Hi guys, Dr. Shaun here. Hope everyone's doing okay. So today we're going to be talking about whitening before dental treatment, okay? So a little bit about what types of whitenings we do here and also how often and how many weeks before any dental treatment you should whiten your teeth. So when patients come to my office and want to get some sort of cosmetic and dental work done, like veneers or anterior crowns, we want to make sure that whatever work they do matches their existing teeth. Usually their existing teeth aren't as white as they would like, so that is when I recommend whitening their teeth first before any sort of treatment. Now, the first thing first is the patient that has to understand that once you whiten your teeth to match the new dental work, then you have to continue whitening your teeth so they can keep matching that work. So if you whiten before your treatment, you're going to have to basically whitening continuously afterwards in order to keep your existing teeth matching your new restorations, okay? Because the restorations will not get any darker, but your teeth will. So the patient has to be willing to whiten their teeth continuously to keep up. Now, I usually recommend whitening 2 weeks before the preparation of any cosmetic dental treatment. This gives time for the color to settle a bit, kind of even out the color. And there are actually 3 options that I give my patients for whitening. There's honestly 4 options, okay? So first option, not to whiten at all, because sometimes patients are like, nah, I don't think I'm going to continue whitening after I get my dental treatment, so there's no point. Let's just go ahead and do the restorations, and that's completely fine. Another option is over-the-counter whitening strips or gels. It's not the best way to get your teeth white because you don't get that uniformity, but it's better than nothing, okay? Now, the second option is custom whitening trays. This is when we take an impression of the patient's mouth and we fabricate the trays for the patient and they whiten it at home with the gel that we provide. It's usually a much stronger gel than the over-the-counter, so this is something I definitely recommend. The third option would be in-office whitening, where the patient will undergo their whitening in the office using a special light. Here at the office, we use something called Star Pure. It's really good for patients that have high sensitivity whitening. It's all organic, and it's what we use here because patients have a better experience than any other in-office whitening. Now, if a patient's never whitened before and they want to whiten their teeth, I usually recommend doing the in-office whitening first to give a really good blast of whitening. And then they use the custom whitening trays at home to do little touch-ups here and there. After the whitening is done, then I usually have the patient wait 2 weeks so we can do a shade match and start prepping the teeth. And then after the final restorations are cemented, the patient just has to continue whitening ever so often. So it's going to be different for everybody. Some patients' teeth don't get as dark as often as others. So it's just something where the patient has to look at the difference between their teeth and the restorations, or every time they come into the dental office, we can check and take a look and be like, okay, now it's time for you guys to whiten your teeth because you're having a dissimilarity between your restorations and your existing teeth, okay? So I'll say it again, I recommend 2 weeks before any sort of anterior restorations, go ahead and start whitening, okay? Well, there you go. Some more information about whitening before dental treatment. If you guys have any questions, please let me know. Have a great day. Bye.